Well, if you have allergies, you've definitely felt them over the last few weeks. I mean, look at the pollen levels right now. Today in the very high column, tomorrow much the same. And Haley was just saying the heat we're getting, not helping with that either. Just going to make more of this show up in our area. In fact, according to the FDA, up to 40% of children suffer from hay fever. Dr. Karen Morgan is joining us now here in studio live. She's a pediatrician at Southern New Hampshire Health, Merrimack Pediatrics. So Dr. Morgan, thanks for joining us today.
Thank you for having me.
So let's talk about, I think parents sometimes struggle with trying to figure out, is my kid having allergies or is this a common cold? Are there ways to tell the difference, and do allergies show up differently in the kids in the pediatric population as opposed to the adults?
So I get this question a lot this time of the year. With the common cold, there tends to be a fever, but the common allergies tend to have stuffy nose, congestion, and you'll sometimes see dark circles, or they'll get irritable or super tired because they're up coughing all night.
And is that different than what you would expect to see like in an adult showing up in the office?
You can see similar symptoms in adults as well.
When parents come in, obviously the kids are looking for relief. And what are the things that you go to right away to say, these are the things to start with to try to see if these work?
So do two treatment pathways. There's a home prevention, and then you can also have medication. Some of the home prevention you can do is after the kids are out playing, they can wash their clothes and shower or bathe them. And sometimes if the high pollen count is happening, you can close the windows at night, and that helps reduce the pollen in the bedrooms. Other things for medication, there's some great over-the-counter products you can do. You can do oral treatments, you can do eye drops, and you can do nasal sprays. All of them have very limited side effects, and they're tolerated very well. And in fact, you can actually give some of the medication down to as young as 2 years old.
Oh. Now, is it kind of a trial and error to figure out which one may work for your kid and the allergies they're dealing with, or overall they all kind of take care of the histamines the same?
There are little differences with different family members and genetics, and sometimes you just have to try a couple different products. That would be when you'd want to reach out to your pediatrician and say, hey, I've tried a couple of different things and these aren't working, and then we can either escalate care, or even sometimes we might have to go to an allergist to target therapies.
So let's talk about each of those. If I'm a parent, I've tried, let's say, an antihistamine and my kid's still having symptoms, is that when I call the pediatrician's office, try to get an appointment with you? What are kind of the warning signs or red flags parents should be thinking about when it comes to it's time to go ahead and go into the office?
So if you've tried a couple products and the symptoms are still lingering, or they're affecting your daily activities such as sports or school, at that point you really want to call out to the pediatrician.
And then in terms of the allergists themselves, these are the experts. When is it time to go and see them for maybe additional testing or additional methods?
So at that point, if you're having these annual symptoms, you might want to call the allergist and see if you can get actually specific targeted what you're allergic to, and that way you can do future prevention when that season comes out. And it's really important to start the season early with pre-treating before waiting till all the symptoms come.
Okay, and then finally, is it possible to outgrow some of these allergies over time, or is this something that if you're dealing with it as a kid, you're probably going to deal with it for the rest of your life?
I think these are things that they'll probably have over time, and with the different pollen season, some seasons are worse than others. And also, you can go to the allergist and get allergy shots, and that can reduce the symptoms too over time with allergy shots.
Good to know. Practical tips, Dr. Morgan. Thanks so
much.
Thank you for having me.
Thank you for having me.
Thank you.